There is a pending amendment by Senator Hutchinson that dealing with medical waivers, which prompts me to come to the floor for just a minute and talk about that issue as it's affecting Georgia today, and in particular, talk about it in the context of what our governor and our legislature are having to deal with right now in terms of the mandates of the health care bill signed on March 23rd of last year by President Obama. In fact, on the signing of that bill, there were a couple statements. I reflect back on those long debates, which I'd like to repeat right now. One was Speaker Pelosi saying about a month before the House passed the health care bill that you had to pass it to find out what's in it. That was a funny statement at the time, but it became prophetic today as we're beginning to discover over and over again the unintended consequences of the legislation on our states and on medicine. Secondly, Vice President Biden declared the magnitude of the impact of the health care bill. That magnitude is turning out to be higher cost, less benefit, and more regulation on our states. In Georgia in particular, and I just want to bring these 2 points up to talk why this whole issue of medical waivers is so important. Our insurance commissioner, Ralph Hudgens, has submitted a waiver to CMS for a waiver on the medical cost benefit rule in terms of benefits paid on policies, taking it up to 85%. That mandate in the health care bill is going to force not better coverage, but less coverage of our insurance companies in Georgia because they'll leave because they can't meet it. It's the intention to regulate the amount of benefits that's paid. The application means companies that can't meet it by the time set in the bill will leave the state. So instead, you have less of what was promised rather than more. You have less available choice and more people forced to a single-payer system in the government operated through an exchange, which prompts me to the second issue that's going on in Georgia. Our newly elected governor, Governor Nathan Deal, is trying to deal with a mandate on setting up the state exchange, trying to set up an exchange that will be available to operate by 2014 in a period of time where the public wants no part of the national health care bill and wants to wait on a Supreme Court ruling on Judge Vincent's opinion in Florida. So I come to the floor to say these medical waivers are important. States are having to ask for them because of the impact of the overall health care bill that was signed on March the 23rd of last year. And if some relief doesn't come, we're going to have some cataclysmic events. One of them will be the impact on employees in small businesses, which is what this bill is all about. And I ran a small business. And I had independent contractors for whom under ERISA you cannot provide health insurance. I tried my best to get this Congress and this president to consider a associated benefit program approval so we could have people in like professions assemble together, form large risk pools so they could compete for insurance like major companies and states do. That was rejected instead for an exchange and for a simple system that says small business must provide health insurance to their employees, but if they don't provide it, they'll pay a modest fine that's much less than the cost of the insurance. That one statement and rule alone forces people in small business to leave health care coverage from an insurance cover that gets it through their employer, and instead they have to force to go to a government exchange where choice is limited and mandates are many. So I just want to commend the distinguished chairman of small business and the ranking member of small business for the effort they're making on this bill, but also commend Senator Hutchinson on the importance of us considering the volume of these waivers that are being filed, why are they being filed, and they are an early warning for what's going to happen to us when this bill goes into effect if we don't take the Obamacare legislation and commit drastic surgery, or better yet, start over and build a system that works where we have the private delivery of health care and a minimum of government interference. And I thank very much the chairman for giving me the time to speak.